Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the spasticity. So first is, what is spasticity? Spasticity is a hypertonic motor disorder characterized by velocity-dependent resistance to passive stretch. Spasticity arises from injury to corticospinal pathways or pyramidal path tracts and occur as a part of upper motor neuron, that is UMN syndrome. The signs and symptoms of the UMN syndrome includes hyperactive stretch reflex, involuntary flexors and extensor spasm, clonus, Babinski sign, exaggerated cutaneous reflexes. And next is the mechanism of spasticity. So what causes a muscle to become spastic? The absence of an upper motor neurons, inhibitory control on the spinal reflex, hyperactive stretch reflex that are mediated by muscle spindle stretch receptors, decreased threshold of the alpha lower motor neurons. So next is the what is stretch reflex. The first step in the stretch reflex is the stretching of the muscles stimulate muscle spindles. Step 2 is the activation of the sensory neuron. Third is the information processing at motor neuron. Fourth is the activation of the motor neuron, and fifth is the contraction of the muscle, and it opposes the first step. So spasticity resulted from a loss of descending facilitatory inhibitory influence that act on a IA interneuron inhibition. Reciprocal inhibition mediated through a IA interneuron inhibition required facilitation from higher centers. With injury to CNS, the interneuron is unable to shut off antagonist muscle firing with resultant increased velocity-dependent resistance to movement. The combination of both decreased inhibition, increased depolarization state of cell membrane, decreased action potential threshold from nerve signal conduction, thus increase activity of structures innervated by the affected nerves. Next are the examples of the UMN lesions. It includes stroke, multiple sclerosis, traumatic brain injury, acquired brain injury, spinal cord injury, cerebral palsy, that is CP. Thank you.